Hello, future healthcare heroes. Welcome back to the channel. If you're preparing for the NCLEX exam, one skill you absolutely must master is critical thinking. It's not just about memorizing facts, it's about analyzing situations, making sound clinical judgments, and delivering safe, effective patient care. In today's video, we'll tackle 30 of the most challenging and essential multiple-choice questions focused on critical thinking skills. From prioritizing patient care to managing complex scenarios, identifying risks, and applying evidence-based practices, we've got it all covered. Critical thinking is the backbone of nursing practice, and as a nurse, your ability to think on your feet can make all the difference. Practicing these questions will help you hone your decision-making skills, enhance patient safety, and build the confidence you need to excel on the NCLEX and in your nursing career. So, whether you're just beginning your NCLEX prep or fine-tuning your skills before the big day, this video is your ultimate guide to mastering critical thinking. Don't forget to subscribe, ring the bell for notifications, and drop your thoughts or questions in the comments below. We love hearing from you. Let's dive in and take another step toward becoming the confident, skilled nurse you're destined to be. Question 1. A nurse is caring for 4 clients. Which should the nurse see first? A. Client with a blood glucose of 78 milligrams per deciliter. B. Client reporting severe chest pain. C. Client requesting pain medication rated 5 out of 10. D. Client scheduled for discharge. Answer: B. Client reporting severe chest pain. Rationale: severe chest pain may signal a life-threatening emergency, such as myocardial infarction, requiring immediate intervention. The other options are not as urgent. Hypoglycemia is not immediate at 78 milligrams per deciliter. Pain at 5/10 is moderate, and discharge can wait. Question 2. Which action demonstrates effective critical thinking by the nurse? A. Following physician orders without question. B. Using objective data and patient preferences to determine care. C. Completing tasks as quickly as possible. D. Delegating all tasks to unlicensed assistive personnel. Answer: B. Using objective data and patient preferences to determine care. Rationale: effective critical thinking integrates evidence and patient values. Simply following orders, rushing, or inappropriate delegation do not reflect critical thinking. Question 3. A nurse is caring for a postoperative client who becomes restless and agitated. What is the nurse's priority action? A. Restrain the client. B. Assess oxygen saturation. C. Call the physician. D. Administer sedatives. Answer: B. Assess oxygen saturation. Rationale: restlessness post-op is often the first sign of hypoxia. Assessment comes before intervention. Restraint and sedation without assessment can worsen the situation, and notifying the physician is appropriate after assessment. Question 4. Which client assignment is appropriate for an LPN? A. New admission requiring initial assessment. B. Client awaiting discharge instructions. C. Client with stable diabetic management. D. Client with chest tube insertion. Answer: C. Client with stable diabetic management. Rationale: LPNs can care for stable clients. Assessments and discharge teaching are RN only. Chest tube management is complex and typically an RN responsibility. Question 5. A nurse notices a medication error has occurred. What is the immediate priority? A. Notify the provider. B. Assess the patient's status. C. Complete an incident report. D. Document in the chart only. Answer: B. Assess the patient's status. Rationale: patient safety comes first. Assessment determines next steps. Notifying, incident report, and documentation are afterwards. Question 6. Which task can a nurse safely delegate to a nursing assistant? A. Monitor chest tube drainage. B. Provide client teaching about diet. C. Perform oral care. D. Assess pain level. Answer: C. Perform oral care. Rationale: nursing assistants can provide hygiene care but cannot assess, teach, or monitor complex equipment. Question 7. Which statement requires follow-up in shift report? A. The client is confused and wandering. B. The client received antibiotics at 0800. C. The client voided 500 milliliters. D. The client is resting quietly. Answer: A. The client is confused and wandering. Rationale: confusion and wandering indicate a fall risk requiring immediate safety interventions. Others are routine. Question 8. When prioritizing care, which client should a nurse assess first after shift report? A. Client with a temperature of 99 degrees Fahrenheit. B. Client with a new onset of shortness of breath. C. Client scheduled for routine labs. D. Client requesting ice chips. Answer: B. Client with a new onset of shortness of breath. Rationale: sudden respiratory symptoms are emergent. The other clients are stable or have non-urgent needs. Question 9. A client is prescribed a new antihypertensive. Which critical thinking step is used when evaluating the outcome? A. Assessment. B. Diagnosis. C. Evaluation. D. Implementation. Answer: C. Evaluation. Rationale: evaluation is the step where the nurse determines whether the intervention, medication, was effective. Question 10. A patient diagnosed with chronic obstructive pulmonary disease is experiencing shortness of breath. After elevating the head of the bed, what should the nurse do next? A. Notify the respiratory therapy team. B. Check the patient's oxygen saturation level. C. Administer intravenous fluids. D. Call the healthcare provider. Answer: B. Check the patient's oxygen saturation level. Rationale: the next appropriate step is to assess the patient's oxygen saturation to determine the severity of the breathing difficulty. Clinical decisions, including notifying other healthcare professionals or initiating further interventions, should be based on objective assessment data. Question 11. During mass casualty triage, which client is given highest priority? A. Client with minor abrasions. B. Client with an open fracture and active bleeding. C. Client with a small laceration. D. Client with sprained ankle. Answer: B. Client with an open fracture and active bleeding. Rationale: active bleeding is life-threatening. Minor injuries are lower priority. Question 12. Which finding should the nurse report immediately? A. White blood cell count 7,000 per cubic millimeter. B. Potassium 3.5 milliequivalents per liter. C. Blood glucose 110 milligrams per deciliter. D. Respiratory rate 8 breaths per minute. Answer: D. Respiratory rate 8 breaths per minute. Rationale: a respiratory rate below 10 breaths per minute is critically low and indicates the need for immediate intervention. The other values are within normal ranges. Question 13. The nurse observes a UAP transferring a weak client incorrectly. What is the best initial action? A. Intervene and provide immediate guidance. B. Report to nurse manager. C. Ignore if the client is safe. D. Document the incident only. Answer: A. Intervene and provide immediate guidance. Rationale: immediate intervention is required to prevent harm. Later steps may follow. Ignoring or only documenting does not ensure safety. Question 14. Which statement demonstrates effective therapeutic communication? A. Everything will be fine. B. Why didn't you take your medication? C. Tell me what concerns you most right now. D. You should have called the doctor sooner. Answer: C. Tell me what concerns you most right now. Rationale: open-ended, non-judgmental questions foster dialogue. The other options are closed, judgmental, or provide false reassurance. Question 15. The nurse needs to administer medications to 4 clients. Who should receive medication first? A. Client scheduled for a routine laxative. B. Client with new onset chest pain. C. Client requesting antacid. D. Client with arthritis pain. Answer B. Client with new onset chest pain. Rationale. Chest pain is potentially life-threatening. Routine, comfort, or chronic pain meds are less urgent. Question 16. When using evidence-based practice, the nurse should first A. Implement a new policy. B. Review relevant research. C. Assess client preferences. D. Ask the medical director. Answer B. Review relevant research. Rationale. Evidence-based practice begins with reviewing current best evidence, then incorporating patient preferences and clinical judgment. Question 17. Which is an example of a correct SMART goal for a diabetic client? A. Patient will understand diabetes. B. Patient will reduce glucose. C. Patient will walk 15 minutes daily for 5 days. D. Patient's diet will improve soon. Answer C. Patient will walk 15 minutes daily for 5 days. Rationale. SMART goals are specific, measurable, achievable, relevant, and time-bound. Option C fits. Others are vague or not measurable. Question 18. Which action demonstrates a nurse's accountability? A. Delegating a skill outside a UAP scope. B. Documenting care provided. C. Ignoring a medication omission. D. Failing to report an error. Answer B. Documenting care provided. Rationale. Accurate documentation demonstrates accountability. Delegating outside scope, ignoring errors, or failure to report is unsafe and unprofessional. Question 19. A client shows signs of anaphylaxis after an antibiotic. What is the nurse's first priority? A. Assess airway and breathing. B. Stop the antibiotic infusion. C. Call the provider. D. Take vital signs. Answer A. Assess airway and breathing. Rationale. ABCs, airway, breathing, circulation, always come first. Other actions follow if the airway is stable. Question 20. A nurse delegates vital signs on a post-op client to a UAP. Later, the nurse notes a temp of 102.5 degrees Fahrenheit. What should the nurse do first? A. Administer antipyretic. B. Assess the client. C. Notify the provider. D. Ask UAP to recheck temperature. Answer B. Assess the client. Rationale. Always assess abnormal findings directly before intervening or notifying the provider. Question 21. Which intervention is a priority for a confused client at risk for falls? A. Place call light within reach. B. Remind client not to get up. C. Turn off alarm system. D. Encourage use of walker alone. Answer A. Place call light within reach. Rationale. Placing the call light where accessible is a practical risk reduction. Alarms should be active and reminders alone are ineffective. Question 22. During a code, the nurse is asked to document. Which action best reflects critical thinking? A. Ignore code and complete other documentation. B. Document what is observed in real time. C. Wait until code is over. D. Write documentation later from memory. Answer B. Document what is observed in real time. Rationale. Real-time documentation is accurate and essential for patient safety and legal purposes. Question 23. A post-surgical client's wound is dehiscing. The nurse's first action. A. Notify the surgeon. B. Apply sterile saline moistened gauze. C. Measure wound. D. Document the finding. Answer B. Apply sterile saline moistened gauze. Rationale. Protecting exposed tissue reduces risk of infection/injury. Notification and documentation follow. Question 24. What demonstrates priority setting based on Maslow's hierarchy? A. Addressing spiritual needs first. B. Attending to client's pain before breathlessness. C. Managing airway clearance before nutrition. D. Providing entertainment for anxiety. Answer C. Managing airway clearance before nutrition. Rationale. According to Maslow's hierarchy of needs, Maintaining a clear airway and effective breathing takes precedence over meeting nutritional needs. Airway and breathing are fundamental for survival and are therefore considered a higher priority in patient care. Question 25. Which situation warrants immediate intervention? A. Client complains of hunger. B. Client is drowsy and unresponsive. C. Client needs assistance to transfer. D. Client requests family visit. Answer: B. Client is drowsy and unresponsive. Rationale: an unresponsive client is likely unstable and needs urgent assessment/intervention. Question 26. What is the safest assignment for a nurse who is temporarily working on the unit and is unfamiliar with it? A. Assign the nurse to care for the most complex patients. B. Assign the nurse only to care for stable patients. C. Assign the nurse to handle all patient admissions. D. Assign the nurse to administer all intravenous medications. Answer: B. Assign the nurse only to care for stable patients. Rationale: nurses who are new to a unit should be assigned patients whose conditions are stable and predictable. This ensures patient safety and aligns with the nurse's current level of familiarity and experience. Patients with complex or unstable conditions should be assigned to permanent staff members who are experienced with the unit's specific procedures and patient population. Question 27. What is the nurse's initial response to a family member yelling at the nurse's station? A. Ignore the behavior. B. Escort the family to a private area to discuss concerns. C. Call security immediately. D. Tell them to leave the unit. Answer: B. Escort the family to a private area to discuss concerns. Rationale: de-escalates the situation and preserves client/family dignity. Ignoring or confrontation is unsafe. Question 28. A client requests information on a new medication. Which is the best initial nursing action? A. Provide a medication pamphlet. B. Teach using medical jargon. C. Assess the client's learning needs. D. Ask the provider to teach. Answer: C. Assess the client's learning needs. Rationale: begin with assessment to tailor teaching. Generic pamphlets or jargon may not match needs. Teaching is the nurse's role. Question 29. A client is scheduled for a procedure but doesn't understand the purpose. What is the nurse's priority action? A. Explain in detail. B. Inform the provider. C. Cancel the procedure. D. Reassure the client everything will be fine. Answer: B. Inform the provider. Rationale: the provider is responsible for informed consent. The nurse must notify the provider if the patient does not understand. Question 30. What is the most appropriate nurse response to a dying client expressing fear? A. There's nothing to worry about. B. Tell me more about your fears. C. Let's get your mind off it. D. You shouldn't be afraid. Answer: B. Tell me more about your fears. Rationale: open-ended, empathetic questions encourage sharing. The other responses minimize or deny the client's feelings.